just like to kind of explore like why PRT versus, other traditional therapies. So, I've done traditional therapy for a long, long time. I've employed traditional physical therapists, massage therapists, others. We've utilized chiropractic, osteopathic medicine, and so forth. So why PRT versus some of these other traditional therapies, be it physical therapy, chiropractic, and so forth? Let's focus on physical therapy first. So why might PRT be really exceptionally helpful, say over or in conjunction with physical therapy? So if physical therapy really hasn't worked for you, then obviously you're going to want to try something different. And so, so what have you been missing, I guess? I think possibly a neural system approach. And so that's what we're going after first. We're not necessarily trying to just increase your strength. We're trying to increase your strength neurally by reestablishing the normal tissue and its nervous system or its neural drive and how it's really allowing that tissue to function. So traditional, therapy, physical therapy, it's very heavily based in, I'm going to exercise, I'm going to do this to increase my rotator cuff tendon, but may not necessarily always, I'm not saying it doesn't all the time, or doesn't occasionally, but it may not necessarily focus in on the underlying neural dysfunction that's really causing the weakness. You may not have muscle weakness. You most likely have neural weakness because everything is dysregulated. And so the difference is we reestablish the regulation to be normal, to be healthy, so that your muscles can respond to therapy, can strengthen, and aren't trying to function in a twisted state. So, normal therapy, we might try to stretch or we might try to exercise that in a dysregulated, twisted state. It's just going to take forever. And sometimes it doesn't work, right? And so if you key in on my latest systematic review with my colleagues in Nigeria on low back pain, it was found, and this is pretty typical in the PRT research among just about every condition you come up with, when you add in this magic sauce of positional-based therapy, oh my goodness, it makes our outcomes in traditional physical therapy so much more superior. And that was the case for low back pain and many others. And so what is it about that? What is it that's causing that to occur? Well, like what I said, this dysregulation, we're now free. We're now free to strengthen. We now have blood flow because we're no longer twisting and constricting tissue. So if this was my blood vessel, it's all constricted. We talked about this being a spindle, a muscle spindle, like a neurologic spring. We want that spring to work correctly. And we want the nervous system not to be highly agitated and upregulated. And so positional therapy, as we know, increases your strength immediately. It unwinds you, it takes pressure off nerves, it increases blood flow. All these are really good things to promote healing and nervous system regulation and overall nervous system health. And so traditional therapy, if you think about like a knotted necklace, traditional therapy in general, even, you could probably put chiropractic in there too. How do we get that knot out? Well, most will, try to pull it apart and stretch it and crack it and, force it with some, as you can see, some of these instruments behind me and really just like scrape it. But, with our particular approach, we function in the 3 R's of manual therapy. Number 1, you've got to release the tissue. You have to get the tissue and the neural system back to its normal regulation, its homeostasis. Then we can work to restore the tissue. And we do all kinds of that therapy here. It's now ready. It's ready to accept the therapy. It's ready to respond. And then that traditional kind of therapy is probably more appropriate at that time. Number 3 is retain. So once we get your neural system health back in order, once we get the tissues to be regulated, then, we're going to want to retain it. And so there is, much like a car, we're going to take it for tune-ups. We're going to kind of work on it. We're going to maintain it either through exercise. We're going to maintain it through personal training, massage, maybe even, I'd recommend every now and a little PRT tune-up, just like a car. And so in order to keep your tissues healthy. And so traditional physical therapy may most likely not have a neural-driven system approach. Okay, so that's our approach here at the Positional Therapy Institute, and one that you will experience the great difference between our particular approach being neural-driven versus many others that involve a very sort of aggressive stretch, hit, not necessarily resetting the neural system at the brainstem level. And so we hope that you'll experience a difference here in Ogden, Utah, and possibly abroad with our certified practitioners.